Some things to keep in mind while you're flossing is that there are people who don't necessarily get perfect exams when they go to their dental office. They're often told that they're not flossing correctly, or even maybe being told that they're not flossing at all. And certainly I can sympathize with that because I know many people do floss. But you just might not be flossing effectively. Keep in mind that when you're flossing, you never want to snap the floss between a contact point. If you're flossing, if you're snapping that floss, what you could essentially be doing is cutting the gum tissue, which is probably already sensitive and sore to begin with. And that would certainly make you not want to floss again. So you want to always ease that floss through. The second problem that sometimes occurs is that when people are flossing, they may ease the floss through, but they're perhaps not flossing down far enough along the gum line. You want to make sure that that floss is scraping underneath that gum tissue until you feel a point of resistance. And you're not using a lot of pressure anyway when you're doing it. You're just guiding that floss. But you will feel that point where you need to stop and then it's time to come back up. When you are in between teeth, you want to make sure you're getting that whole space. That space should be filled with that floss. So in a situation like this where it's an expanding floss, you'll see that that is going to even fill the largest of spaces and be very effective with that flossing. And again, please always remember, go to that back tooth, get underneath those bridges and the crown areas, implant areas, all the specialty areas in your mouth that need that extra attention.